Joining us now to talk more about it, Dr. Peter Hotez. He's the co-director of the Texas Children's Hospital Center for Vaccine Development and dean of the National School of Tropical Medicine at Baylor College of Medicine. Doctor, as always, it is a pleasure. Removing the vaccine requirements for federal workers, is this the right move?
Well, it's already been done in effect, because what happened was the Biden administration asked for federal mandates starting towards the end of 2021 during our horrific Delta wave, when so many unvaccinated Americans were losing their lives from COVID-19, when the vaccines were more than 90% protective. But then, if you remember, the federal courts a few months after that, in January of 2022, blocked it for the federal workers, although they allowed healthcare workers to remain, to require mandates for healthcare workers, which I thought was the right thing to do. So the courts have blocked the federal requirements for most workers for quite a while. We have to remember the origin of these mandates, how desperate the president was, the White House, those of us in the healthcare professions were, as we watched so many Americans needlessly perish because they refused COVID vaccines during the Delta wave. And now the epidemic has changed in the United States, so that so many people have either been vaccinated or infected and vaccinated. We're not seeing that same horrific death rate. So I think it may be the right time to relax mandates, although I have mixed feelings even about that.
Another component to this, though, is not having access to tests, or the tests may be expensive, so it might dissuade people from getting them. Is there concern in that in terms of the prevention, that will take a hit?
Yeah, I mean, this is the problem. We're all flying blind at this point because, the Johns Hopkins tracker doesn't have access to data. We're not getting a lot of data from the Centers for Disease Control about how many new cases are actually happening on a daily basis. And it was already complicated by the fact that so much testing was going on at home. So we need, there's still a lot of new cases, and almost all of my colleagues, and I'm sure, many Americans know friends and colleagues who are still getting infected with COVID. So, now we're not really following it much at all, and that's truly problematic.
And why is that?
Well, it's one, as you point out, lack of access to diagnostic testing, and the states are not really providing the data to the Johns Hopkins tracker, to the Centers for Disease Control. I mean, the way this works is the whole system relies on state and local health departments providing the data. And if they're not collecting the data and providing it, then we just don't have access to it.
That's concerning. I want to get your thoughts on this. There's a new COVID variant that is spreading as this virus mutates across the U.S. It's called Arcturus. Doctors are warning that it can cause conjunctivitis, pink eye. Many know that as pink eye. There has been a spike in cases nationwide, some in North Carolina, also in Los Angeles, and the CDC saying nearly 10% of reported COVID cases last week are of this particular strain. What do we know about this strain? Is it more contagious? Who's susceptible?
It looks like it's slightly more contagious than the XBB 1.5 that has been circulating for in the past several months. The question is, what do you do about it? Well, the most important thing is many Americans do not realize that there's a difference between this new bivalent booster that's been available since last September and the previous monovalent boosters. The bivalent booster is better set up to get these new Omicron variants, like either XBB 1.5 or XBB 1.16. Only 17% of.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider, and don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.